Opipramol is a medication to treat general anxiety and somatoform disorders. In this video, let's find found. What is Opipramol? What is Opipramol used for? Contraindication. What are the side effects of taking Opipramol? How does Opipramol work? How to use Opipramol? What is Opipramol? Opipramol, sold under the brand name Insidon among others, is an anxiolytic and tricyclic antidepressant that is used throughout Europe. It was developed by Schindler and Blattner in 1961. What is Opipramol used for? Opipramol is typically used in the treatment of generalized anxiety disorder, GAD, and somatoform disorders. Preliminary studies suggest that Opipramol shows potential clinical significance in the treatment of severe sleep bruxism. Contraindication. Contraindications include: in patients with hypersensitivity to Opipramol or another component of the formulation, acute alcohol, sedative, analgesic, and antidepressant intoxications, acute urinary retention, acute delirium, untreated narrow-angle glaucoma, benign prostatic hyperplasia with residual urinary retention, paralytic ileus, pre-existing higher-grade atrioventricular blockages or diffuse supraventricular or ventricular stimulus conduction disturbances. Combination with monoamine oxidase inhibitor, MAOI. Side effects. Frequently, greater than or equal to 1% to less than 10%, reported adverse reactions with Opipramol, especially at the beginning of the treatment, include fatigue, dry mouth, blocked nose, hypotension, and orthostatic dysregulation. Adverse reactions reported occasionally, greater than or equal to 0.1% to less than 1%, include dizziness, stupor, micturition disturbances, vigilance, accommodation disturbances, tremor, weight gain, thirst, allergic skin reactions, rash, urticaria, abnormal ejaculation, erectile impotence, constipation, transient increases in liver enzymes, tachycardia, and palpitations. Pharmacodynamic. Opipramol acts as a high-affinity sigma receptor agonist, primarily of the sigma-1 subtype, but also of the sigma-2 subtype with lower affinity. Unlike other TCAs, Opipramol does not inhibit the reuptake of serotonin or norepinephrine. However, it does act as a high-affinity antagonist of the histamine H1 receptor and is a low to moderate affinity antagonist of the dopamine D2, serotonin 5-HT2, and alpha-1 adrenergic receptors. H1 receptor antagonism accounts for its antihistamine effects and associated sedative side effects. In contrast to other TCAs, Opipramol has very low affinity for the muscarinic acetylcholine receptors and virtually no anticholinergic effects. Mechanism of action. Opipramol is a tricyclic antidepressant agent. Opipramol acts as a high-affinity sigma receptor agonist, primarily of the sigma-1 subtype, but also of the sigma-2 subtype with lower affinity. Cyclic antidepressants block the absorption of the neurotransmitters serotonin and norepinephrine, making more of these chemicals available in the brain. Half-life. Opipramol is rapidly and completely absorbed by the gastrointestinal tract. Its terminal plasma half-life is 6 to 11 hours. Dose. Depression. Adult, 50 to 300 mg daily. Safety advice. Opipramol should only be prescribed during pregnancy, particularly in the first trimester, for compelling indication. That's all the information about Opipramol we collected. Thanks for listening. Do not forget to like, share, and subscribe for the HeInfo channel if you like this video to update more health information.